Hello and welcome to the Gifted Ed podcast. We are your hosts, Angel Van Howe, Gifted Coordinator and SEL Facilitator,
and Meghan McCarthy, Social Worker.
We're grateful for the opportunity to share this space with you today as we talk about the complexities of giftedness. So let's get started.
Today we want to introduce Dr. Maha Zayed to our listeners.
Really helping them see that in order to learn something, you have to practice it, right? So it's kind of like if driving a car is challenging, you wouldn't talk about that. You would have to help them practice it a little bit at a time.
She's a licensed clinical psychologist and owner of the OCD and Anxiety Center.
If the average student is spending 2 hours studying a day, we want you to set a timer and just do 2 hours. And then after that, that's it. And let's see what happens.
Yeah.
She specializes in working with kids, teens, and adults who struggle with anxiety, OCD, and anxiety-related disorders.
So really just emphasizing that we want them to practice the skills so that they have it for their lifetime. And it's going to take being a little bit uncomfortable. And for parents too, because turning in an assignment incomplete can be, uncomfortable for them. But you'll see over time that it's okay.
She provides cognitive behavioral therapy and exposure-based therapy and has had the privilege of seeing people get back to their happier, healthier lives where anxiety and OCD are managed in a relatively short amount of time. Welcome, Maha.
Hi, thank you. Thank you so much for having me.
In today's episode, we will discuss how gifted students may experience and present their anxieties, as well as how teachers and adults can respond to their needs. I wanted to start off with my first question. Can you describe classroom behaviors that signal or may indicate a student has an elevated degree of anxiety? What would those look like?
Sure, yeah. So I think this can look like many different things. So sometimes what we see is inattention, fidgetiness, irritability. Sometimes it's asking a lot of the same questions over and over and over again. It might look like isolation or trouble engaging with other students or peers or the teacher. It could look like asking to leave the classroom, trouble getting into the classroom or coming to school, tantrums, crying, sometimes opposition.
Mm-hmm.
So it can look like a lot of different things. And sometimes those things people think that it might be something else like ADHD or trouble with hyperactivity or something, but it's an underlying anxiety issue.
Oh, that's so helpful to know. What about anxious behaviors that are like even less visible or understood by teachers and adults? And I know that kind of ties into what you were just saying because some of them mask as other things.
Sure.
But I'm just thinking of maybe certain kids who are very, very quiet.
Sure.
And who aren't displaying maybe the typical behaviors that we would, look to see.
Yeah. So being quiet, isolated are big ones. Other things that might not be so obvious might be like procrastination and missing assignments or the opposite of perfectionism. So we see kids who are reading and rereading and writing and rewriting, and it's not so obvious because you can't really tell, or you think it's just that they're overachieving, but really it's anxiety. We see other things that might not be so obvious are reassurance seeking. So this might look like just asking a lot of the same question or asking questions, but really it's to alleviate anxiety. So I think those are big ones. Somatic issues, so complaints about headaches, not feeling good, nausea, needing to go to the nurse, might not be so obvious, but can be anxiety related.
Can you tell us a little bit more about how anxiety, I guess, does that to us? Why is it that we become more inattentive or, display those behaviors?
Yeah, I think what happens is we feel anxious, and so we want to do something to alleviate the anxiety. And oftentimes, it might be worrying. So a student is in their head ruminating or just replaying or thinking over and over and over again. So it looks like they're not paying attention, but really they're ruminating or having anxiety in their head, worrying. Other things like reassurance seeking. So if a student is really anxious about something and they want to alleviate the anxiety, they might seek to ask a lot of questions over and over to alleviate the anxiety. So any behavior that alleviates anxiety works to maintain it. But essentially that's what happens is we feel anxious, so we want to do something to get rid of that, whether it be avoidance or leaving the classroom, seeking reassurances, ruminating, whatever it is.
Right.
That's kind of how that behavior comes about. And and works to maintain the anxiety.
That makes so much sense. Thank you.
Mhm.
And it does make sense when I'm thinking through like the cycle of if we're focused on an OCD behavior, right? And then that takes us away from the lesson that's being taught. And then if we are able to return back to their peers, then we're anxious about what we may have missed. Like
Sure.
it just that whole
It's the cycle.
cycle. Yeah.
And that creates anxiety. And then, doing a behavior to alleviate the anxiety,
Right.
and then you're missing more. And
Yeah.
it's just
And
a
if that
cycle.
behavior is obviously every OCD behavior can be different, but if it presents as more misbehavior in the classroom,
Right.
then you add that layer in of punitive, it's just
Right,
complex.
right.
Complex,
Yeah.
for sure.
I think that's true sometimes. Like we see a lot of kids who have opposition
Oppositional,
or
yeah.
tantrums or missing assignments, and sometimes parents or teachers accidentally think that it's just them being oppositional or rude or disrespectful or lazy, and and at the crux of it is a lot of anxiety.
And probably too assumed choice.
Right,
That
right.
the student's choosing to.
Or it's intentional.
Yeah.
Yeah, it's on purpose.
Yeah, that's a lot.
Mhm.
Another element with the gifted profile is we know that gifted students may experience emotional intensities. So how do we support students to process differences between how they experience anxiety versus how they experience panic?
Sure, I think so. The first thing I think is teaching students that some anxiety is normal, right? So anxiety in general is pretty normal. It helps us to prepare and essentially to fight or flight, right? When there's a threat.
Right.
And then, and so, for example, if there's a test, a normal amount of anxiety will help the student to prepare to study for, a normal amount of time, or what would be developmentally appropriate, and take the test. But then when anxiety gets elevated or starts to interfere or become too much is when the person attributes that there's a threat or something really, really dangerous related to that trigger. And oftentimes the trigger is just something neutral, like a test. And
Got
so
it.
really teaching, I think starting off by teaching the student or the child that, a normal amount of anxiety is okay, but then now it's becoming too much and it's starting to interfere, and it's because we're misattributing the signal as something dangerous. And now this is challenging with kids, right? Because cognitively they, it's hard for them. They don't always have the cognitive ability to say, oh, look, my brain is misattributing this as something threatening, right? And
Yeah.
so
It's like the size of a problem versus
Yeah.
the reaction.
Right,
Yeah,
right.
size of the reaction.
Right.
Yeah.
And so I think what we do sometimes is just teaching them that this is like, quote unquote, my anxiety monster, or my anxiety friend is overreacting. right?
Depersonalizing
Yeah.
it.
Yeah. Like taking it away from them. And it's just this other thing, whether it be a monster or a friend or a companion or whatever is interfering right now. And so recognizing that it's something else and that
Yeah.
it might not be like true or real can help them kind of, create some distance.
Speaking from a kindergarten perspective, back in the day, when I taught kindergarten, I just remember a lot of lessons focusing on where we feel things in our body, right? And with anxiety, what does that actually feel like in your body? Do your fingers in your hands, do your hands clench? Do you feel tightness in your chest? What about your stomach? Does it feel normal, or does it feel like you have butterflies? So just paying attention to those physical signals first tended to help. I don't know if that's something that you agree with, or
Yeah, absolutely. Like, so, a lot of times, especially for little kids, it shows up in their bodies and they don't really know what it is. And then whatever they're feeling in their body becomes scary, right? Because it doesn't feel normal. I'm having all these physical sensations. And that's kind of sometimes when we see like them not feeling well or needing to go to the nurse. And so teaching them that it shows up in their body and how it shows up, and then it's just this thing, it's not anything dangerous. It's just this thing.
Well, and
I think
especially if you experience anxiety on a daily basis,
Mhm.
it almost becomes your norm of feeling, right? So you can't really distinguish what's different
Right.
because you're constantly feeling it.
Mm-hmm. Yeah.
And I'm thinking too, just through anxiety versus panic, because whether you're the parent or the teacher or whomever working with the student, it seems like, or is it fair to say, with anxiety, depending on how intense it is, that could be really good to kind of keep pushing through and to support the student, to reassure, yes, you feel uncomfortable. Feeling uncomfortable is okay. Let's keep pushing through this. Where when we get to the panic, that's kind of where we can't just push through panic.
Right.
We have to endure it in a supported place, but then kind of de-escalate. Is that a fair way to approach?
Yeah, I think sometimes when we think about panic, I mean, true panic comes about untriggered and you feel it in your body and you start to have massive physical sensations. And then you get really anxious of those physical sensations. But I think sometimes when people think about anxiety at a 10, they label it panic, right?
Okay.
It's kind of like when anxiety gets to be so much and you can't push through. And I think at that point, it would be helpful to just help the student just kind of ground and orient them to their environment, to do some deep breathing, diaphragmatic breathing, and just kind of bring it down, because anxiety that high, it's impossible to like cognitively
cope with.
To deal with it, or behaviorally. You kind of need to bring it down a little bit and then help them to push through.
So kind of looking at anxiety as like a scale versus panic is just panic.
Right. I think so. Yeah.
Okay.
Yeah.
And this touches on what we were saying earlier. How can adults and teachers respond to students experiencing different degrees of anxiety? How can they be supportive? To go back to what you were saying, sometimes, we perceive it as a choice or it masks as something else. How do teachers discern? Like, what are ways for them to discern what approach to take? Because sometimes it can be those things.
Right.
But in terms of anxiety, it wouldn't be. So how do you propose to go about that?
Yeah, touching on what we just spoke about, I think if it's so high that it's so visible, like they're having a panic attack or it's physically obvious, I think helping them de-escalate first. So giving them like a quiet room or helping them take some time to deep breathe or get grounded or that kind of thing. But essentially, I think what I want to stress is that first understanding where the level of anxiety is, which might be hard, but sending the message that wherever they're at, if it's a little bit tolerable, that they can push through it and still do the thing, whether it's sit in the classroom or do the reading or take the test or do a math problem, that they can still do the thing that's creating anxiety at least a little bit, because we want them to see that despite anxiety, they can move forward and go on and do the thing and be uncomfortable. And when they do that enough times, they see that it's no big deal, that anxiety doesn't have to run their lives. They can still do the thing. But I think depending on where they're at, they may need some accommodation to be able to do that. So that could be like leaving the class for a few minutes or going to the nurse or using a fidget toy or a sensory space or, going to the bathroom or asking the reassurance question or whatever it is to be able to do the thing, if that makes sense.
No, it does. That's really helpful.
What are the tendencies that may prompt or increase experiences of anxiety, such as like temperament or cognitive reframing, personality types, childhood experiences?
Yeah. So we know that a couple things can lead to anxiety. So both organic, genetic, and environmental factors. So people who have family members, grandparents, parents with anxiety, OCD are more likely to have anxiety or OCD just off the bat. And then environmentally, different things can lead to that. So trauma, is a big one that can lead to anxiety. But then just kind of the way the household is set up. So like households that are more strict and rigid and over-controlling are more likely to lead to anxiety.
Can you give us an example of how that might look in that household?
Yeah. So it might be where everything is a catastrophe, right? Like, so the worst case is going to happen in a lot of scenarios. So, you can't stay out past 12 o'clock because that's when you're going to get into an accident or someone's going to kidnap you or the bad thing is going to happen and you won't cope. And that occurs over and over and over again. That
message
kind of
is
thought
reinforced.
process.
Yeah.
And fear, I guess like fear is driving
the decisions.
Right.
Yeah.
Okay.
And so you kind of learn, oh gosh, I can't veer from what I normally do or what's expected because something bad is going to happen, instead of developing a more flexible mindset of, it's okay, it's just 30 minutes later, it's not likely, and if something bad happens, I can cope. you kind of, start to live your life in a way where you have to stay within the rules so that nothing bad happens.
I'm totally thinking of perfectionism and how
I
much
know.
it fuels
I
the
know.
anxiety
And the sense
because
of control that
and
we think we
failure
have.
and all these bad
Right.
things are going
Yeah.
to happen if I don't get, this correct answer.
Right.
And then where OCD then feeds into that
Right.
so easily, right? If I do
Right.
these
Mhm.
behaviors. Yeah.
Right. If I do these if I study 6 hours and
Mhm.
do everything perfectly, then I'm going to get a good grade. And then if
Mhm.
you keep doing that, you think you got the good grade because you did it like that instead
Right.
of seeing
It reinforces it.
yeah,
Mhm.
that I can miss a couple answers or I can just study for 3 hours instead of 6 and still do okay. And even if I don't do okay, it's okay. I'll cope
Yeah.
with it.
Mhm. I know I interrupted you. I'm sorry.
Oh, that's okay.
We were talking about, I don't know if we touched on personality types or cognitive framing. And
Yeah, so the cognitive framing, I think, is kind of like the all or nothing thinking or the catastrophe or
Mhm.
seeing the negative in things when there's positives too. It's coming at things from that thinking process can lead to a lot of anxiety because you start to see the world like that instead of more
Right.
flexibly or in between. Bad things can happen, but not all the time. Or if something bad happens, I can deal with it.
Yeah.
That kind of thought process. Personality types, I think things like people pleasing, perfection is being a little more inhibited. There's a lot of research on being inhibited, mainly to anxiety or
Hmm.
kind of like being more shy can lead to anxiety. And so I think those are some personality characteristics that can lead to anxiety.
So when you were saying in terms of the rules in a class, whatever the context is, the power of so things are going to happen, right?
Right.
Let's build some skills. Like how are we going to deal if your worst case, maybe not start with
Right.
worst case scenario,
Right.
but something goes unexpected. Let's talk through what skills would be helpful to have in those moments.
Mhm.
Because I feel like too, you always hear, high school and then students go to college and sometimes, we don't have those basic
The
life skills
Right.
of just being able to cope with
Right.
when things don't go our way, because sometimes things have been padded or
Protected
Right.
or
Or students compensate because they can put
They
in 6
can.
hours.
Yeah.
So then
Right.
it reinforces, like you said, that's what I need to do to be successful because they have that potential to give so much. And then they mistake that to mean that that's what they need to do.
Right. I think first and foremost, like accepting that sometimes bad things happen and that when that happens, you'll cope instead of if I just prepare and protect and do it a certain way that the bad thing's not going to happen. It's really accepting that sometimes bad things do happen and I'll deal when it happens. And it might not be the worst case scenario, right? Like there's all these other possibilities of things that could happen. And I think really like what we stress is really practicing that, right? So like if we see a child who's really struggling with perfectionism, we might have them turn in an assignment incomplete.
I'm so uncomfortable, I'm sure.
Or like having them do the things that are really challenging and hard so they can see that it's okay. Like it ends up being fine.
Sun rises.
Yeah.
Any advice for teachers how to approach this with parents in that instance where, something is not correct and they hand it in and they get several wrong. Sometimes parents' reactions can be concerning about that. How do we help parents understand that as well?
I think, so really helping them see that in order to learn something, you have to practice it, right? So it's kind of like if driving a car is challenging, you wouldn't talk about that. You would have to help them practice it a little bit at a time.
Right.
And so here, if the skill is practicing being good enough instead of perfect or being able to mess up or fail or not do it perfectly, then we have to practice it over and over and over so that it gets a little bit easy and that they see that whatever they're worried about doesn't necessarily occur or that they can deal with it, right? And so one way to practice would be to turn in an assignment, not perfect. So miss one assignment or miss one question on the assignment. And we never want to do it so that it's to the extreme, right? So it wouldn't be like skip the whole thing. It might be just get one wrong. Or, another way that we would teach them to do it is if the average student is spending 2 hours studying a day, we want you to set a timer and just do 2 hours. And then after that, that's it.
Done.
And let's
That's
see
a really
what
good
happens.
idea.
Yeah.
So really just emphasizing that we want them to practice the skill so that they have it for their lifetime. And it's going to take being a little bit uncomfortable. And for parents too, because turning in an assignment incomplete can be uncomfortable for them, but you'll see over time that it's okay.
Mm-hmm. Thank you.
So we want to wrap up just by leaving you with some reflection questions. The first is, think about how you have responded to students who presented as anxious. What was challenging about it for you? What may help you support students experiencing anxiety further?
Given our conversation today, Maha, what is one thing that you would invite our listeners to do for a call to action?
Yeah, I think in the classroom, I know that teachers have so many students, and it's
Right.
really hard to pay attention to the couple that are really struggling. But I think it's noticing if they are exhibiting any of the behaviors that we talked about, that maybe it could be anxiety, and just pointing out to the student, I see you're struggling. Can we provide some sort of accommodation or something to help you, and then can you continue, so that you can show them that they can be effective even when they're struggling. So it's just kind of recognizing and labeling that they're
Mhm.
struggling and trying to help them stay in the situation, because I think oftentimes what we see is that people want to avoid
Mm-hmm.
when they're anxious, and
Makes sense. Yeah.
and like,
Mhm.
parents and teachers want to make the person feel good or make the child feel good, and so they help them to avoid or escape, and by accident that makes the anxiety worse. And so I would want them to see that they can stay in the situation and still deal with it, and move forward without escaping or avoiding.
That's a great suggestion
Yeah.
to help
Mhm.
with awareness. Thank you.
Thank you so much, Maha, for being with us today. I know there's a lot here that I'll be chewing on for a long time.
Myself as well.
Yeah, thank you so much for having me.
We want to thank you for joining us in this space today. Please subscribe to the Gifted Ed podcast to stay up to date with our latest episodes. Stay tuned for our next episode that continues to unpack the complexities of giftedness.